Yes, the practices are coming from the aims. So let us try to adopt what makes an aims, and that is what really will make us a Vikasit Bharat. When each of the medical institutions, their directors, deans, medical superintendents will really, with open hearts, with open mind, will really adopt and accept this aims pedagogy. And somewhere or the other, the government is doing a lot. The Ministry of Health and Family Welfare is trying to its level best. The top down efforts are happening, but ours is more of a lateral, a professional kind of an effort कि भाई हम भी कुछ गिरिराज जी में अपनी लठियां लगाएं, so that this entire model of excellence can be proliferated across. Over to Dr. Surbi.
So, I would like to say here one more thing, that medical curriculum in itself, it involves a lot of self-study. Self-study in the sense of, we say that a medical student always keeps on studying and learning to the last breath. So this is something that learning and studying is a part and parcel of your career. Even when you are a full-fledged doctor, there might be some cases which would, every day you would reflect upon, spend a few minutes or an hour at least, an hour or two, in reflecting upon, touching upon the latest research papers, CMEs, and so on and so forth. And a lot of cases are involving multidisciplinarity, so, well, if you are a specialist, even in the specialty, there are several intonations, narratives which need, interdisciplinarity. So that is very important. So to understand that the human body is an integral whole. And I would urge that even those medical students who are having an aspiration of becoming a top-notch super specialist, well, we must have this concept, this principle clear from the very first day, that you might be a neurosurgeon, you might be a cardiac surgeon, you might be an endocrinologist, or you might be a GP. Your understanding of the human body as a whole, interlinking the various systems, should never go for a six. And it is, I am just quoting here in generally what is the problem faced by the patients largely, because you see, we have to keep on going back and forth. Here the essential nuggets of medical education have to be listed right at the outset, so that we know in under what guidelines are we approaching our program. You see, द्रोणाचार्य तो शिक्षा दे रहे हैं, पर अर्जुन बनने के लिए हमें वो we have to have those ज्ञान चक्षुष, we have to have that एसर, वो मछली की आंख की तरह अपना गोल बिल्कुल क्लियर होना चाहिए. So where in NEET examination, where you are applying for the medical entrances, rank is important. But when you enter the medical college, it's important that you get your principles, your concepts, your understanding of the medical disease spectra very, very vividly and completely. Friends, I must tell you, it helps a great degree when your concepts are embedded in your brain, and it just unfolds with like reflex action when you're seeing the patients. It helps. And when our professors are banging on our head with saying that, in the physical examination, of course, I would like to say a lot about, the clinical methods in physical examination. Today, with the host of medical diagnostic technologies available, it is quite easy for the doctor or the treating physician to tell the patient, go and get a CT scan done or an MRI done, and the diagnosis would be clear from the CT or MRI very easily. But this is the dynamics which we need to understand. So here I'm bringing again back and forth the concept of the diagnosis through physical examination, history taking, is how important it is. And if there has to be a protocol of approaching the patient. You see, if you're writing a CT or MRI in the very first instance, you are going away from the clinical protocol. You are missing essential steps in the history and physical examination, which could have guided to a
I think,
different
Dr. Saab, that
diagnosis.
is something we will be picking up in more of a clinical part of it.